Hello everyone, welcome to my gender-based medicine assignment. In this video, I will discuss the difference between sex and gender and the important biological and behavioral differences between both male and female sexes. Then we will take a look at how gender-based medicine affects the medical professions, more specifically physical therapy. And we will come up with some new approaches to gender-based care so that we can build a lasting rapport with our patients so that they trust us with their care no matter who they are. Before we dive into the rehab room to experience gender-based medicine live in action, we first need to know the differences between sex and gender. Sex is the biological composition of either a man or a woman. We're looking at the major biological differences such as hormones. Women are going to produce estrogen and men are going to produce testosterone, more so than women. We're going to look at the genetic DNA. That's going to be the difference in chromosomes. The male sex is going to have a double X chromosome, whereas, the female is going to have a double X chromosome, whereas the male will have an XY chromosome, where the Y chromosome comes from the father. And then last but not least, more obvious is the reproductive system and sex organs. We know that males have a penis and testicles, whereas females have a vagina, ovaries, and a uterus. Now, the difference between gender identity is a person's innate identification as a woman, man, or something else that may not correspond to the person's external body or assigned sex at birth. This usually occurs with an influence in a person's life. For example, if a boy is primarily raised by a female household, he may grow up to take on more maternal characteristics. He may be more interested in clothing and things like that, whereas other boys who are brought up in a masculine home may be interested in aggressive sports and getting dirty and things like that. When treating somebody based on gender alone in physical therapy, there may be some challenges that arise. First thing that comes to mind, well, first I should explain that within physical therapy, there are so many different settings. So different challenges that may be faced at different settings are going to be kind of summarized in this video to the main, most important concepts that I would like to cover. First, I thought about room sharing. In the skilled nursing facility, sometimes they have shared rooms. A female may not be comfortable sharing a room or a bathroom with a male, so that could pose a potential issue if just treating a patient based on gender alone. Also with physical therapy, modesty. The way we cover patients when we treat them. If they're doing straight leg raises, we make sure that we drape them and properly cover them, which leads to different palpation techniques as well. If we are working on a pec muscle of someone who we assume is a male, we may not think that, hey, we should put a cloth over the top of them because Bob sitting next to me is a male and he may be aroused or uncomfortable seeing exposed breast. Also with physical therapy, heart rate is very important, and I know females have a higher heart rate than a male. So when assessing these patients, we need to look at a Borg scale, which is their perceived rate of exertion, not their actual heart rate, unless we are calculating heart rate max based on them being the biological sex. Men are going to have a greater amount of muscle mass versus a female, so that's going to be a noticeable difference for a physical therapist when they're hands-on with the patient. Also, there are pathologies that females are more prone to having than a male, such as osteoporosis, Alzheimer's, and things like that, which may lead to um, an incorrect diagnosis or physical therapy evaluation. Also, uh, medicine metabolism is going to be different in a man versus a woman. A woman's metabolism is going to be a little bit slower, and some medications may sit in their stomach a little bit longer than a male. Or vice versa, depending on the medication. And that's really important for a physical therapist to know, especially if they're basing their treatment time around a patient who needs to have pain medications before their physical therapy treatment. Okay, now that we know what physical therapists or physical therapist assistants are up against, let's take a look in the rehab gym and see how our physical therapist assistant handles a patient who is not what they appear to be.
I really think that my husband is kind of
Hello,
forward.
Deborah. My name's Alicia. I'm a physical therapist assistant. How are you today?
I'm good. Hope you're having a good day.
I am. So I hear you fell a couple weeks ago and had a hip replacement. How are you feeling?
I'm fine. Feeling better on the mend.
Okay. Well, that's good to hear. Good to hear. Okay, so my plans for today are to do a few lower extremity exercises with you. I want to make sure that you're maintaining your hip precautions, so I'll be keeping a close eye on how you're doing things, and then we'll go from there.
Okay, that sounds great. Can I use the bathroom first, though?
Sure, absolutely. That is actually one of the things that we can work on here in therapy. It's getting you up and showing you how to use the toilet while maintaining your hip precautions.
So you're going to go with me?
Yes. Just make sure you're safe.
Great.
Right this way. Let's take a pause for a minute and really look at the hesitancy in the physical therapist assistant's patient. He really wasn't sure if he wanted her to go to the bathroom with him or not. Most people that fall within this population are very self-conscious about their changes. And some of them are not 100% confident yet in who they are, which leads to, unfortunately, so many negative aspects of gender-based care. For instance, the lack of health insurance coverage is probably one of the biggest problems. Most insurance companies will not cover sex changes as far as surgeries, hormone supplements, and things like that are often denied. So this population really has a hard time finding coverage to transition between sexes. The lack of follow-through for medical care. As mentioned before, this population is very insecure, or at least most of them are, about the changes that they're going through. They're afraid of being judged, so they don't always follow through with seeking medical care. Some people may be afraid of physical therapy because they know that the therapist may feel or touch things that they don't want them to. Also, as mentioned before, with the incorrect diagnoses, that can hinder a population where a medical professional is treating a patient solely based on their gender. Unfortunately, I have statistics here. 54% of transgender youths have attempted suicide, and 21% resort to self-mutilation. Again, the lack of coverage for health insurance really, really is a problem for this population. We already know that our therapist had an issue to begin with. Let's see how she handles the actual treatment. Okay, Deborah. This is our bathroom. Here's the grab bar. Do you have grab bars at home that you're going to go to?
I do.
You do? Okay. Well, then I want to make sure that you're using that. Okay. We'll move the walker over to the side. Then I'll have you lift your dress up. Okay.
You know what? I changed my mind. Could you leave?
But unfortunately, since I've never seen you go to the bathroom before, I need to stay here and make sure that you're going to be safe.
Can't you just take my word and believe that I can do it?
Unfortunately, I cannot because these floors may be wet. Anything could happen, and I want to make sure that you're maintaining your hip precautions.
So you're just gonna persist on this. You're not gonna leave.
For your safety, yes. Once you sit down, I'm more than happy to walk out the door and give you some privacy.
Okay. Well, look, this is kind of embarrassing for me to say. Actually, it's not. I'm totally proud of it. I don't know how you're gonna take it, but I'm in the process of something in my life. I'm going through a gender transition, and I don't want you to be unsettled by the fact that you're gonna see something that you might not be expecting to see.
Deborah, it is quite alright. Honestly, anything that you tell me will stay between us, okay? 100% confidential. We'll make sure that we address the appropriate things we need to make sure that you're safe.
Okay.
Okay? Alright, Miss Deborah, you all finished?
Mm-hmm.
Yes? Good. Everything go okay?
Yeah, thanks for being cool about everything. I appreciate it.
Absolutely. It's what I'm here for. Just to reiterate, everything that you tell us is 100% confidential. It's up to you whether you disclose your information to anybody else. Okay? But I do want to let you know, in the future, when you're going to physical therapy or a doctor's office or anything like that, it's very important that you're upfront with your sex. It can affect medications, prescriptions, and even your heart rate is going to be a little bit higher in therapy. So we would need to look at your projected heart rate and things like that and base them off of, being a man instead of being a woman for the physiological aspects of your body. Okay?
Okay.
All right, well, thank you for being such a great patient.
Thank you.
Let's help you get up and get out of here. Don't let your dress get stuck in your underwear.
Thanks. I still need assistance in that area. Still trying to figure that one out. Is this okay? As you can see, at the end of the treatment, the patient opened up to the physical therapist assistant. That is going to be the most important thing that all medical professionals can do, whether or not they are in the physical therapy profession, is build that rapport with the patient. Have them trust you, have them be confident that they have made the right decision to seek medical treatment, regardless of what they're going through. Also, some things that we can do to incorporate gender-based treatment and make it better is possibly include the option of checking off gender, not just sex, as well. That would help with a lot of professions, especially the physical therapy profession. We can, as I said, build the trusting relationship with the patient, ensure them that whatever they say or do is going to be kept strictly 100% confidential unless they want to disclose their information to anybody else. It's also important to have a very open line of communication with your patients. Use terminology that they can relate to and ask them what terms and how they would like to be identified. I did refer to the patient in this video as a male for the simple fact that I know, obviously, that my coworker is a male, but we really want to address this with the patient. You get some alone time with them, take them to a private room, and really open up and discuss this with them. Let their wants and needs be heard. Well, thank you for watching, and I hope you learned a little bit about gender-based medicine.